Hello, hello, hello. This is your favorite doctor, Dr. Jason Hayes, Democratic candidate for Lieutenant Governor, right here in the great state of Georgia. We are coming to you today, episode 6. We're going to talk about something that is so important, even I'm blown away. We're in crisis here in Georgia. Maternal mortality. Coming here to Georgia, I've been here for about 8 years. This is a great state. I live in a great community here in Alpharetta. Alpharetta is great. I have a medical practice here. But the more and the more that I've gotten involved politically, that is running for state rep in House District 49, now running for lieutenant governor, my eyes are opening more and more. Finding out Georgia's ranked 43rd in healthcare. And then also we have several counties, especially in the south of Georgia, that don't even have OBGYNs, pediatrics, internal medicines. Hospitals are closing down. Rural hospitals, what we call critical access hospitals. We're in a state of emergency. COVID-19 essentially has made everything worse. The pandemic, people being sick, some people not wanting to get the vaccine, still being sick, resources being used, hospitals closing down. Now we're in a situation where we have a Governor Kemp, and a Republican legislature that does not want to pass Medicaid expansion. Medicaid expansion would really help matching federal funds to keep hospitals open. But the more and more I looked, it's not just an issue of not having insurance or access, but women and also children are dying. So I'm gonna go ahead and just jump right into it. It's an article I found, and I'm gonna just, again, I always tell people I'm a board certified internist. I practice adult medicine, adult care, physicals. I deal with diabetes, high blood pressure. My obstetrics and gynecology training is limited to medical school. So I'm not an expert in the field, but still did the research. And there's an article that I looked up, and it's from Grady News Source. And the title of the article is "In Georgia, the most dangerous state for pregnant women, policy change could save lives." And this is put out October 25th, 2020. First sentence of this article says Black women in Georgia are 3 times more likely to die from pregnancy-related complications than white women nationally, according to data from the Centers for Disease Control. Georgia, which has the second highest maternal mortality rate in the nation, is the most dangerous states to be pregnant in today. According to the CDC data published through American Health Rankings, Georgia's maternal death rate reached 66.3 deaths per 100,000 live births from 2013 to 2017, as opposed to the national maternal death rate of 29.6. That means pregnant Georgians were 2 times more likely to die during pregnancy and up to 1 year postpartum than the average American. This is unacceptable. This is unacceptable during this time, during this age. Women are under attack. And yes, maybe the way how the system is, it isn't directly attacking women, but it's indirectly attacking women. And let me tell you how. Again, my credentials. I'm a board certified internist, but also I have a master's of science in public health, studied healthcare administration. I've also worked with the National Health Service Corps. That's a program that was started in the 70s along with the advent of federally qualified health centers. The goal is to get doctors and other healthcare providers to underserved communities. So I've worked in a rural community and urban community. I've seen patients, adults, both male and female, or I should say men and women. So public health is something that is a part of me. It's a part of the fabric of my medical education, medical training, my medical practice. So when I look at these statistics, I say, my God, we are supposed to be one of the best places in the world for medical care. But yet here we are, Georgia, with these staggering statistics with women. So one thing I want to explain to people, and again, I'm going off of my medical school education and training for obstetrics and gynecology, is that women deal with high risk situations with their pregnancies. And a lot of times when we're dealing with high risk pregnancies, uncontrolled diabetes, uncontrolled blood pressure, obesity, those chronic diseases makes a pregnancy difficult. For example, if someone has a young lady has uncontrolled blood pressure, it puts the pregnancy at risk. I don't know if you've heard of things called preeclampsia and eclampsia, where the blood pressure is high. And if it becomes worse and it's not controlled, then the mother conceives, she can die. Now, the best way to treat that, obviously, is control the blood pressure. And if blood pressure is not being controlled and you have to deliver the baby, there can be some consequences to that too as well. Preterm labor is what they say. That is labor before its term. So same thing with diabetes. There are times in women, if they're obese and or if they're at risk for diabetes, they can develop pregnancy-induced diabetes as well. The child can be at risk for, we say, macrosomia, increase in size. So that can make actually the vaginal birth difficult. When we talk about vaginal births, um, what can happen is that there can be bleeding, there can be tearing of the vagina. There can be a lot of complications when we're dealing with, and same thing with dealing with the C-section. You know, you have to deal with bleeding. You know, if the blood sugar is in control, you have to deal with wound healing, things of those nature. And I say wound healing from the C-section. So there are a lot of things that are happening here in Georgia. And you also have to factor in a few other things: substance abuse, the child being at risk for being addicted to heroin, uh, cocaine, crack cocaine. There are a multitude of concerns and issues that can happen. Fetal alcohol syndrome, if you're drinking alcohol, things that could affect the child. Smoking, things that could affect the child and the mother as well too. So there are even cases where women actually haven't had their prenatal checks. They could be showing up to the emergency room pregnant, time to deliver. So I was having conversations with several OBGYNs, not only here in Georgia, but in Tennessee. And one of the concerns that was brought to my attention was that when a woman doesn't have insurance and becomes pregnant, they can get on Medicaid. But right after they have the child, they have about 60 days or so where they can remain on Medicaid and they're taken off. Well, postpartum, a lot of things can happen to the woman. Postpartum depression, suicide can occur, blood pressure being controlled, strokes, diabetes being uncontrolled, strokes, heart attacks, things of this nature, blood clots. Pregnancy state can actually induce blood clots. So those things can affect a woman postpartum. Now, there have been individuals, policymakers here in the state level that have fought to try to increase the amount of timing that a woman can stay on Medicaid. But the right answer is we have to allow a woman to stay on Medicaid after they have their child. So that's huge. We have to definitely do that. The second thing, which probably should be the first thing, is that we have to make sure that we get doctors to underserved areas. I mentioned before to all of you that I was a part of a program called the National Health Service Corps. Did that for 4 years. Well, this program can be used to get OBGYNs into these underserved communities. Now, the question comes up, number one, is that why we don't have OBGYNs in these communities like south of Georgia, pockets of Atlanta, pockets of Columbus, uh, pockets of Athens, pockets of Augusta. Well, when you think about it, and I, talk to some colleagues, if you're in a community where the poverty rate is high, people don't have jobs, they're uninsured, the health isn't the best, that puts the pregnancy in a high risk situation. So if the pregnancy is high risk, there are a lot of OBGYNs that do not want to take on this. Number two, the reimbursement rate. When I talk to a colleague who practices obstetrics and gynecology, the reimbursement rate for a procedure on a woman is significantly less than a similar procedure that's done on a man by a urologist. So when we discussed further, the issue is surgical subspecialty. Urologists are surgical subspecialty, and we tend to group OBGYN into primary care. Well, guess what? OBGYN, obstetrics and gynecology, they're surgeons as well. So when we also look at the inequities that we're dealing with women's health, we also have to look at the pay gap. Most OBGYNs are women. It's women's health versus urology. Most of the doctors are men. They're taking care of men. So there's a pay gap. So if you're in a situation where you're an OBGYN, you want to start a practice, you need to be supported. So if you're in a community that has a high poverty rate, Medicaid is not reimbursing you well enough, you have high risk pregnancy, so your malpractice insurance is going to go up. And then let's pray that nothing happens during the pregnancy, but let's just say you have a bad outcome, neonatal death, postpartum death of the mother, maternal mortality, we should say, that affects your malpractice insurance. So for an OBGYN to go in and practice in a community where you have a lot of risk is difficult. And it's in a rural community. Many people want to be in bigger cities in Atlanta, and Augusta, Savannah. So again, I'm a strong advocate for federally qualified health centers and then using these health centers to recruit doctors through the National Health Service Corps. So again, I mentioned in previous episodes that Georgia has 148 counties that are deemed medically underserved. That's 148 out of 159. So when we talk about medical underserved status, that's assigned by the Georgia Department of Health and Human Services. We utilize census tract data, and we look at the number of FTEs, as full-time equivalents of doctors, versus the population of people that's there. And we also look at other variables too, the demographics, race, we look at that, male, female. We also look at socioeconomic status as well. So when we look at medical underserved status, we have to use this data. Now, again, with the federal government under HRSA, Human Resources Services Administration, I was a part of that. Again, National Health Service Corps is with it. When you're looking at underserved communities from the federal level, we call it HPSA, Health Profession Shortage Area. So they're pretty much similar. Medical underserved areas on the state level, federal health profession shortage area. So HPSA designation, you could have a HPSA score of 10, 12, 15, 20. The higher you go, that means more of a need in a community. So for myself, someone running for lieutenant governor, I would be proactive about this. Not only just proactive from a legislative standpoint, but I would work with the Department of Health and Human Services here in Georgia. I would work with the Department of Health and Human Services on the federal level because they are over HRSA, Human Resources Services Administration, and HRSA is over the National Health Service Corps. So I would work with them so we can figure out the HPSA scoring of these underserved communities. And I would be proactive with working with legislation. So whoever's the state senator, state representative in that area would have to look to identify community leaders who want to come together and put together a community board, a business plan. And I have skills at doing a business plan as well. I'm in my own medical practice, actually did my own business plan through the benefits of having an executive MBA. But we would get a business plan together, find some land, apply for this grant, public health service grant section 330, get federally qualified health centers. We get that there. We get the community on board. We get doctors there, OBGYN, pediatrics, internal medicine. When we do this, we have communities that get healthier. Young people see their pediatricians, the parents can see their family practice doctors or internists. If you get pregnant or if you have reproductive needs, you can see OBGYN. We can reduce maternal mortality. But we need leadership who understands these processes, who understands these policies. And out of all the not only lieutenant governor candidates, the gubernatorial candidates, I'm the only one that has the skill set, the experience working. I've worked as a medical director, an interim medical director at a federally qualified health center. I've learned how the finances operate with the federally qualified health centers. Again, I have a master's in public health. I've studied Medicaid and Medicare. So we get these FQHCs as federally qualified health centers. We're recruiting these doctors. We're helping communities. And then you factor in Medicaid expansion. We get Medicaid expansion and we raise the reimbursement rate and make sure that OBGYNs are paid appropriately, not only as primary care specialists, but also as surgeons for the procedures that they do. We'll get more doctors in those areas. We'll reduce maternal mortality, reduce neonatal deaths. And I've mentioned this to other people before. We need hospitals. So using the same census tract data that I'm mentioning, and also looking at something called CON, Certificate of Need, we can look to bring some hospitals. There's money from CMS called DISH money. That's basically federal money that's allocated through Medicaid to help hospitals that care for uninsured indigent peoples. We get these hospitals, we can get the funding there, and get this, residency programs. We get community residency programs at these hospitals. Each one of those slots, there's funding from the CMS, that is. That's the Centers for Medicaid and Medicare. So there's more funding to the hospitals. The other thing I like to explain people from a business perspective, when we're talking about business, these hospitals can be considered anchor tenants. Well, what I mean by that is that if you have an anchor, then business can feed off of these hospitals. Doctors' offices coming in, medical supplies coming in. People need to eat, restaurants coming in. You have people coming into these communities. You have to build homes and houses, and there's shopping. You improve businesses and communities. I also mentioned this too as well, medical school. We have 2 medical schools here in Atlanta. There's Morehouse School of Medicine, which, by the way, is a great institution led by Dr. Valerie Montgomery Rice, who's making a strong effort to get more minorities, especially Black males, into medical school. Doing a great job over there. She's the president and also the dean of Morehouse School of Medicine. It's Emory, great institution. They do a great job with not only primary care, but subspecialty care. Both medical schools are great and their residency programs are great. There's MCG, Medical College of Georgia in Augusta. They do a great job of taking care of patients in Augusta. They do a great job in the surrounding rural communities. But in the south of Georgia, we could get more hospitals, medical school there, in conjunction with residency programs. We can effectively train doctors, recruit doctors, train them, keep them there in South Georgia. And then we do that, make communities healthier. Then we also focus on economic plan, economic growth that I mentioned before, where we're teaching small business ownership. We have a small business SBA on a Georgia level, showing people how to do business plans. We're showing people how to get funding. We're working with corporations, asking them to invest in communities in exchange for a tax break. Focus on community hiring, community job training. We can fix this, but we need good individuals who understand public health, who also understand business, who understands medicine and policy. Out of all the candidates running for lieutenant governor and also governor as well, I'm the only one. Now, I'm not being bashful about what I'm saying. I'm being confident that Georgia will have someone who understands what needs to be done to fix it. People talk a lot about revenue. With Dr. Hayes, you want to have Medicaid expansion, you want to increase the reimbursement rate. Where's your revenue going to come from? Georgia has one of the lowest tobacco tax rates in the country. It should be well over $1. Get revenue from that. You also decrease people from smoking. You need to tax these corporations because as of right now, we as Georgians pay more personal tax than corporate tax. So those are funds right there. And we got to look at other things to do, what we can do to try to bring a revenue here in Georgia. So it's not just focusing on just Medicaid expansion and saying everything is fixed. It's a multitude of things. So we need people that can see not only just a tree, but that can see the forest. And we have some great legislators that are running for lieutenant governor, but they're politicians. I'm no politician. I'm a doctor. I'm a public health specialist. I'm a small business owner. I understand budgeting. I have an executive master's in business. I have leadership skills. I've worked as a congressional intern. I've worked on the state level doing health policy. I have the skills to help push Georgia forward. We need to make sure that we get good leaders in office. We need to make sure that we get good people who understand the current gravity of the situation that's going on right now. This is Women's Health Month. Women's History Month. This is Women's History Month here in Georgia. We've got to make sure that we do better by women. We've got to make sure that we do better by children. We've got to do better. And it's not because of a lack of effort by any political figure that we have, but we need people with skills, the know-how. I want to represent Georgians. I want to make sure I do a great job for mothers and for children. I want to make sure I do a great job doing what's right and supporting and representing OBGYN, physicians and surgeons, pediatricians, internists, family practice. We've got to make sure we win this game. I want everyone to understand that we have to, again, look beyond the race, and we have to make sure that we push and do great things here for Georgians. As I come to a close, I want everyone to understand the gravity of the situation with maternal mortality. We are in crisis here in Georgia. We're in a state of emergency, and I plan to do something about it immediately. Elect Dr. Jason Hayes, candidate for lieutenant governor. I'm not here for a party. I'm here for people. Go to www.jasonhayes4forga.com. Also text Dr. Jason Hayes to 90678. We have to change this. This is America. We should not be dealing with this right now. We should not be in crisis here in Georgia with maternal mortality. I plan to fix it. I will fix it. Again, this is Dr. Jason Hayes, candidate for lieutenant governor right here in the great state of Georgia. I'm also your host and executive producer of Beyond the Race. Thank you for tuning into this broadcast. Hope you have a great day. Bye-bye.